In this session of the People's Parliament, we discuss the health service delivery in Uganda, especially in the many public facilities now available. A 2011 report by an NGO, Voluntary Service Overseas and Helps Uganda, lists gross understaffing, inadequate pay, crumbling infrastructure, and shortages of medical supplies and equipment as Uganda's major healthcare challenges. On maternal health alone, the number of Ugandan women dying during childbirth remains alarmingly high at 435 per 100,000 live births, meaning that 6,000 women die every year due to pregnancy-related complications. More to that, the Uganda Medical and Dental Practitioners Council puts the number of doctors in the country at 3,894 as of June 2012. With a population of about 35 million people, this means that there is only one doctor for every 10,000 Ugandans. Even then, 8 out of 10 doctors are located in urban areas, leaving only 2 doctors to rural areas where more than 80% of Ugandans live. Another report by the council stated that at least 2,000 doctors have left the country for greener pastures abroad in the last 5 years. We must, however, be thankful to government that we are no longer discussing the availability of health centers, but rather the quality of health services. Honorable members, let this session begin.
Welcome to the third session of the People's Parliament, a platform where Ugandans debate and share ideas on topical issues that affect them. Agnes Nandutu, the Speaker of People's Parliament, presides. Madam Speaker, I propose that we discuss the question, is government doing enough to deliver quality health services to Ugandans?
Those in favor, aye. To the contrary, no. Aye. Ayes have it. You are welcome to NTV People's Parliament, and I am Agnes Nandutu, the Speaker of this Parliament. This is a platform where all Ugandans are given an opportunity to have their say on issues that affect their everyday life. And the topic today is a very important topic that affects all Ugandans. And the motion is government doing enough to deliver quality health services to all Ugandans? Honorable members, let's keep the ball rolling. Is government doing enough to deliver health services to all Ugandans? Honorable member.
Thank you very much, Madam Speaker. I'm Bians Henry. I'm here to say that the government has not done enough as far as the health sector is concerned. We all know that health is a fundamental right, and it being a fundamental right, the government has an obligation as stipulated under Article 20, Clause 2 of the 1995 Constitution. The government has failed due to lack of services in the hospitals, the lack of medicine, the lack of operation machines. Let us try to compare the government-owned hospitals to the private hospitals. Let us say the missionary hospitals or the Islamic hospitals. Take a keen look at Nsambia Hospital, compare it with Mulago Hospital. It's totally parallel. The absence of ambulances, whereby if someone gets an accident, is pushed down a pickup, a police pickup, by the time he's taken to the hospital, he's already dead. That one accelerates the risk of the loss of life. Are you focusing on only the referral hospitals or the entire health centers throughout the country? I'm focusing at the entire health sector in the country, not only
which
referral
hospital
hospitals.
Is lacking ambulances? Go
to my own village. I come from Luka district. We don't have an ambulance. The car that acts as an ambulance is the LOC5's car. When the LC5 has gone for a conference in Kampala, which means if someone is dying, he'll die. The money that is supposed to reconstruct and renovate the hospitals has been used to buy tear gas.
Thank you, Honorable Member. You are out of time. Your 3 minutes are over. The member holding the podium. Is government doing enough to deliver health services to this country? Order, Honorable members.
I'm Honorable Haban Nwabine.
You're welcome, Honorable Haban.
The government has somehow tried, but to a greater extent, it has failed.
What do you think they have done best? And what do you think they have failed to do? Can you outline to us some of those issues that you have at your heart?
The government has tried to build some hospitals, but though you go there, but you don't find there any drug. So I credit it for that. But failure to maybe to introducing the drugs within those built structures, I may call them structures, but because a building without drugs is not surely an hospital, but I can call it a structure.
Are you sure there are no drugs in hospitals?
There is no way how you can be suffering from maybe cancer and they give you Panadol. So they must give you that, a drug related to that.
Order.
The government should increase on the salary wages of workers, because you go in the hospital and you find that the workers are surely treating you as if you're something else, and it is not their fault only that they are paid, their wages are low, so they are having poor working conditions. That's all I had to think.
Thank you, Honorable Member. Yes. You have the podium. What do you think government should do to improve the health service delivery in this country?
Madam Honorable Speaker, thank you. I'm called Brian Atweye. I'm from Kinkizi West.
You're from Kinkizi West?
Yes, I'm
from Kinkizi West. You're representing Kinkizi West?
For the moment.
Please, represent them well, Honorable Member.
It is very important to always note that when you speak about the health sector in Uganda, you ask yourself whether itself is not sick. We have a sick health sector in the sense that our people that are treat us. If we hear students at the Makerere Medical School complain of not having equipment, and they turn out doctors to work on our mothers, on our children, and on us. What do you expect from such a system if the systems are not sham themselves from the beginning? I have heard the former speaker say that government has built structures. The structures this government...
they are everywhere in the entire country. There are referral hospitals, there are health center 4s, there are health center 3s, there are health center 2s at every parish throughout the country.
Yes, Madam Speaker, I will continue and tell you that monitor those structures after every 5 years. Either because of the rampant corruption within, the roofs are gone or they are collapsed. You can see a good structure today called the hospital today, and then you count 3 years from now, the structure will be gone. I can assure you. That one I'm sure.
So what do you think government should best do to at least to get rid of these problems?
I think
that you are
I think at the moment, this government that has spent 30 years in power here, and people are dying every day increasingly. I do not have what to advise it. People have written concept papers. People have advised
you are
government.
A Ugandan, Honorable Member?
Yes. How much does the doctor get? How many people do we lose in this country as they go to other countries to work for them? And ours are dying here.
Thank you, Honorable Member. You have made your point. Please, let's stick to the topic. Is government doing enough to deliver quality health services to you Ugandans? And if not, what should be done, Honorable Member? You are holding the floor.
Thank you very much, Right Honorable Speaker. I am Honorable Christopher Atim. I come from...
Which constituency are you representing, Honorable Member?
Wow, this one is one tip which is not even recognized, Kole District. Thank you. Allow me say this. I don't, and I strongly believe that government isn't doing enough to deliver quality health services in Uganda, basing on the following reasons. Let me go straight to my points. One, when we check on the institutions that government has built, trust me or not, honorable members, that when you get there, we don't have enough health workers in these hospitals.
But you Ugandans are not interested in science courses.
Exactly. Allow me say this.
So if you're not studying sciences, what should government do to have many doctors in the country?
Secondly, when you go and check around, we so far have 112 districts in Uganda. But when you try to break it down into sub-counties, you might find that in one district, they have around 6 or 7 sub-counties, but they have only one health unit in the whole district. And they have, possibly in the whole district, there's one ambulance. Trust me, the roads are impossible. People cannot go through these places. At the same point, the government is not allocating enough funds in the health sector. Rather than they are looking and allocating money in other sectors which are not important.
Thank you, Honorable Member. Your time is done.
Today, I must say government has not done enough to equip the health sectors, or has not done enough to give us enough health sectors. Because today, I see in different places or different districts, I think I am seeing buildings, government built up buildings and just put signposts that a hospital or health center 3 or health center 2, when they do not have enough drugs or enough personnel.
Are you sure there are no drugs in hospitals?
Deep down.
You people, are there no completely drugs in our hospitals, health centers?
Allow me flow. In my sub-county, the sub-county I come from, for example, we have only one doctor, and this man stays in the town, and he comes to the sub-county here every morning. So you can get that in a day there are more than 50 patients, and he can't work on them. He can't work on them for a day. I mean, time. Being one person, he doesn't have enough time to look at everybody. That's why many times you see that people die. I mean, a pregnant mother has died while giving birth because this guy did not get enough time to attend to everybody. He was actually still working on one. Now, another point I want to make. If If these are not building, why do they go abroad to get treatment? That means they actually, to get treatment. If these are not buildings, thank you.
Thank you. Thank you, Honorable Member. He has specified a very important point. There is a recent report that showed that Uganda spends about 350 billion just to take VIPs for treatment abroad. Do you agree with this? What do you think government should have done instead of spending all these 350 billion? Yes, you have the floor.
Thank you very much, Madam Speaker. I'm Musimbe Geoffrey, Nakasongola constituency, where health services are very poor. The whole sub-county, there is only one health center 3 that is operating the whole sub-county. Health center 2s, they are not there. If you agree with me, clap. If you don't, now I'm lying. Now, the problem of...
Do you agree with him that there are no health centers?
They are not
I have
there.
found them in the villages. There are very many health centers too.
In your village, there is no.
Go
now
ahead
I
with
don't
your
know.
point, Honorable Member.
Another thing, the problem of Uganda and is service delivery. Corruption has entered into it. That you find out that services are there to be provided because we pay tax to work on those things and those issues. They are getting the drugs from the drug shops where they keep those drugs from. They take them to their private hospitals. You find out that in the government hospitals, there are no drugs. And if you go there, as the previous honorable said that if you go there, you want a medicine for cancer, they give you Panadol. That's the system that is there. If they tell you that the medicine is there, you go there, you will find out. Maybe some of the members are just lucky that for them they can afford to go to private hospitals. But when you go to government hospitals, go there as a spy.
So what do you think? Should government privatize
Way forward.
The health sector?
Let me start from that one. The government should not privatize because few people can afford to go even to private hospitals.
Okay.
And there are only those who are rich that go there. What they should do, they should put in more effort to improve the government health centers.
Thank you, Honorable Member. Your time is out. Please,
Thank you very much.
Have the podium.
Thank you so much. Right, Honorable Speaker, Madam. Once again, my name is Wangela Rogers. I represent Kongasis constituency. It is found in eastern Uganda.
You're welcome from Bukwa, Honorable Member.
Thank you so much. In Bukwa District Hospital, we have resorted to using Kenya. That is, we refer our patients to Kitale.
So you think our neighboring country, Kenya, is doing better than Uganda?
Actually, a lot.
And what are the services that are being provided in Kenya that are not in Uganda?
Still, we have faced challenges during operations. Ladies who are delivering, most of the time, some of them deliver on the way when they are referred to Kapchoro because of roads, poor roads. So to improve on that,
so the road infrastructure has a very important role to play in the health sector, yes?
If there is a hospital somewhere, let them connect it to somewhere where it is fair. Because if you will have an ambulance and it will get spoiled within 1 month because of poor roads. Not allowed.
Go ahead if you don't allow. Another
thing is the government has tried a lot to motivate these health sector staff members.
Order,
most especially, I've been in Kivito Health Center 4. It is in Kabarole district. And I found out that they have tried to motivate the clinical officers by increasing their wage. What about the lab technicians? What about the midwives? Huh? That means you are motivating this one and this one is not. Remember that in the health sector, if a technician makes a mistake, that is total failure.
When we come back, we are going to discuss what do you think has gone wrong in our health service sector that used to be the best in the country. You are still watching NTV People's Parliament, a platform where everybody has an opportunity to come and debate on issues that affect their everyday lives. That's why we say this is the only program that has democracy in this country. It's not partisan. So when we went for a break, we were discussing the very good health sector that we had in the 60s. What has gone wrong? Honorable Member, you have the floor.
Again, we're in Tugume, Ndorgwa West. And I'm going to rely most on health center 4s and health center 2s. But what structures are there without facilities, without utilities like electricity, like water, like toilets, and you've just put a structure and there's no even health worker there. The health workers who are there are not enough. You find you have a nurse who is a nursing assistant. Is the one running a full health center 3 or health center 4. Yet health center 4s should have at least a minimum of a doctor. I agree with you. Those who know Lake Bunyonyi where it is, there is that health center in the middle of the lake. They don't even have
on the island.
On the island. They don't even have an ambulance over the boat to help those people there on the lake.
What is the name of that health center?
Guama Health Center 3.
That's what I listening. There is Guama Health Center 3 that is in the middle of the lake, and there is no boat.
There is no boat that
take patients
such people, such women to take them there.
How do you
expect such people to get there?
Thank you for that information, Honorable Member. Please, you have the podium, Honorable Member.
Thank you, Madam Speaker. Honorable Jackie Nakaga from Kumba University. Government should use our money, the money of Ugandans, our money effectively. Instead of buying vehicles, new vehicles every year for members of parliament and iPads, let the government use that money to provide medicine. In my health center at Watuba, Buambo, along Buambo Road, when you go to that health center and you're suffering from any disease, be it malaria, I'm assuring you you're going to get Panadol and amoxicillin. Fine. So if you have enough money and you're lucky enough, you will go to the private hospitals. But then this is an area where people are very poor and not educated. Most of the people there are laying bricks. Those who are lucky enough to get some money are getting it out of bricks. And those who do not have that money, those who cannot lay bricks because they don't have that land and the soil maybe to use, they'll go to the health center and keep getting amoxicillin and Panadol. Thank you very much.
But there are many of us, you people, when you qualify, your option is to go and work abroad. So what do you think government should do if you're leaving your country and going to work abroad because you think there is more money? Which procedure do you want to give? Please take the microphone.
We are discussing why the health sector was of a robust kind in the 60s.
Yeah.
And what has happened today.
What has gone wrong?
And I think in this section, the procedure has been adulterated, and we are not discussing it. We should discuss
what has gone wrong with our health sector? Stick to that point, please.
First and foremost, you know that our government is not emphasizing on our budget. First of all, they have a very good organization which they do their work in mobilizing tax, collecting tax. That's URI. They mobilize, we thank them, we give credit to them. But where are the people's money put? First of all, what they emphasize is they budget, their first budget is budgeting on material things, like you're emphasizing on the defense of the country where there is no instability. In which place? At least those days in 2000, coming to 2004, there was instability. At least you can say that let defense be the first priority.
So you think the government is not giving enough money to health sectors?
Yeah, the money which they locate to health center is not enough. At least health should be the first priority. Let me tell you that they say that if you're a healthy mind, if your health is okay, that's how even you can move, you can go and defend your country. If you're weak, even though they bring for you those aeroplanes, they bring for you those, let me say that, RPGs, all those weapons, how can you manage them? How can you control them when you're weak and you cannot manage those materials? The only thing, let's first the government first put health as the first priority in this country, so that they see that if people are healthy, they manage. Like for instance, those days, those previous regimes, you find that in 1960 coming to 1979, you find that these people in those presidential regime, they were emphasizing on health, where you find that the structures, the health structures, even though, for example, you see, go to Nakasongola Hospital, built by Obote, go to Masindi, go to Abim district, those structures put by Obote, they are still strong, even though that's what even the government is doing. But right now, go to health center which the government has built, you find that they are doing only solid work, where they give a contractor who has no paper. Because of these corruption things, they say that under table things, the buildings are weak.
Thank you, Honorable Member. You have made your point.
I'm going to tackle two issues. One, the level of corruption in Uganda is eating up every institution. In the 1890s there, our presidents had love for Ugandans. I'm going to cite out that this regime doesn't have love for fellow Ugandans. That's why you see a son of a minister will get sick and will be taken out for medication. And you, a poor Ugandan, you rot in Mulago. Another thing, Madam Speaker, that I want to cite out is all of us here, we come from villages. Most of our health centers even family planning pills are not there. That's why you find a mother who goes there, is very illiterate, asks for family planning, and they give them Panadols.
Information.
Allowed. 1 minute.
Really, I want to just add on something which she has said on health and family planning. For instance, the government is putting a lot of money, like 5 million in buying condoms for Ugandans, like they hear that all Ugandans
but those are the condoms to keep you healthy.
There are other
avoid
issues.
The unnecessary pregnancies and HIV.
No, those are just like you're promoting HIV and AIDS to people, like showing them that you people go and have sex. Then we shall provide.
Thank you for your information, Honorable Member.
Thank you very much. Thank you very much.
Order in the House.
Thank you very much.
1 minute to finish.
1 minute. Let's ask ourselves that this institution every year, students graduate in medicine. Why is it that we don't have doctors in hospitals? The government has failed to raise salaries for doctors. That's why you see someone will graduate and go to a neighboring country, Kenya, and we have Ugandans. A situation happened recently in Kabale Hospital. Students were going for a trip and they got an accident, but only one doctor was working on 20 students. It is a shaming. Thank you very much.
Thank you. Thank you. Honorable Member, you have the floor. What has gone wrong in our health sector?
What the government should do is, first of all, we need to build referral hospitals in each and every district. And that's what Obote was doing. And it's no doubt that Uganda was the role model by then, by 1960s.
Yes, Honorable Member.
I'm here to say the government has done totally nothing in improving health. I come from Mityana district. We don't have any facilities provided to us. We have the structures, yes, but in regards to health, the sanitation of Mityana as a hospital is in such an alarming rate. You go to Mityana, when you have gone for treatment, you come out with a disease you can't explain. You know, most of the health centers of Uganda are facing the same problem. I happened to be in Mulago 4B sometime back. You know, the easing rooms of Mulago are built within the wards. Christ, like the ladies, the only facilities that we got, because I had taken my sister, was a catheter, because she was going to be operated. And everything was to be bought from Wandegeya. So as a government hospital, where we are supposed to receive the services as taxpayers, I was alarmed. Because we were supposed to pick the forms, take them to somewhere, some department where they give us drugs from, and going there, they say, we don't have that. Maybe, how about going to Wandegeya? So I was wondering whether the store of Mulago is located in Wandegeya. So that was the alarming rate of health. So another thing, Uganda as a country has failed to respect its independence and sovereignty. How could Uganda as a poor country respect SAPs, structural adjustment programs? In cost sharing, how is a poor person going to share a cost? Yeah? Because we expect that Uganda knows the state.
But as being a developing country, don't you think that was a good policy?
No.
To make Ugandans afford the drugs?
No, Madam Speaker.
For government pay?
I would say that because a person who was brought up to study the Africans' problem, Professor Elliot Badge, was a white person who could not in any way have known African problems. Well, they would have gone to Makerere, picked a professor who has been in Africa, who has been in Uganda for some period of years to study Africa's problem. So I think this kind of code sharing was applied in a country that was not supposed to be.
Thank you. Your time is up.
Thank you.
For that point. Yes, I'm glad to have ladies on the podium.
Thank you, Madam Speaker, for the opportunity given to me. My name is Kaija Harrod. You say you were asking what really went wrong. At the time when we had a strong health system, colleagues were telling you that was the time you hear first grandchildren produced abroad. At the time, that is where I would see the president of Uganda going to Mulago, the ministers of Uganda going to Mulago. What would that do? That would motivate the health workers, and they would keep them at check.
And also save the money.
Exactly. You know, in a way that if you expect the president to be coming, or if you expect your boss to be coming here, you feel that you keep yourself at check. But in a scenario where they know they will never treat a minister, they'll never treat a president, everybody does his business. You talked about putting up health centers. I am a Christian. They tell me a church is not just a building. A church is people. Former Minister of Health, ironically, Honorable Malinga, died because the health center in his district never had first aid. He only needed first aid to keep living. The next hospital was 40 miles. 40 miles on a Maramu road is like 150 kilometers on tarmac. So at the end of the day, we lost a minister just because of that. I was looking at the budget framework of Uganda. A parish every financial year is given 4 million. Most parishes in the villages, they have around 3,000 people. If you came to Kampala, you may find a parish like Kasubi has only just voters, 25,000 voters. So if you add on others who are not voters, you may find around 60,000 people. But the money given to them is 4 million. The other day we saw on NTV Kisenyi Health Center closed. Why? There are no equipments for doctors to use because it was in Kisenyi. You had the doctors and health workers in Bujiri and the like closing up. So in such a situation, when there is no will, when our leaders go out, the first thing they pick is a business card of a doctor. So what they would be doing is you ask your colleagues where you go, how do you do, what do you do to have a better health service? I'll give you another example. You talked about privatizing. Last week, I went to visit a friend at IHK who was sick. I asked the price of a room. A room is $108 per day, which is 291,000 shillings. That money, we had a colleague here who said, who they were criticizing for refusing a job of 150,000 per month. So the money that person will earn per month will not care for a room in IHK for what? For a day. So it means that in a situation whereby 84% of Ugandans don't have jobs, and those who have jobs earn peanuts, we cannot afford the health system of this country.
Thank you, honorable member. Come on, Ugandans. This parliament is not only the youth, it's for all people regardless of age. You have heard honorable members have talked about lack of facilities in those health centers that are up country, the health center 3s, the health center 2s, that are community based. Those are the hospitals, those are the health services that can give services to people immediately, give first aid. So what should be done? What are the facilities that we need in those health centers, honorable members? When we come back, we shall discuss what are the facilities that should be put in those health centers to allow Ugandans access health services. You are still watching People's Parliament, a platform where all Ugandans can come and discuss issues that affect their everyday life. So do not demonstrate, just come and be a member of Parliament and air out issues that are affecting your lives. Honorable members, when we went for a break, we were discussing the facilities that should be put in those community-based health centers to allow Ugandans access quality health services. What do you think should be put to those health centers, honorable member?
Thank you, honorable speaker. I'm called Masiga Juliet from Chambogo University, representing my district, Busia District, Samia South. The government should improve on the transport network, like providing the ambulances. In my district, in my village, the one hospital has no ambulance. And this is a hospital which was built a long time. The government is not maintaining it, but it has gone on to build another hospital somewhere else, to which it has not put, like they built a hospital, they didn't put water, and they put flush toilets.
Thank you, honorable member. Services in those places, please read at this. Let me hope you're listening. These are people's voices. We need beds, we need drugs in those hospitals, we need ambulances, we need a good road network to access those health centers. Yes, honorable member, what is your say?
I truly believe that the government has done something.
Thank you.
And it's wrong for us to dispute the efforts the government has put in to improve the health sector. But I think it's us as individuals that are given offices of responsibility. We go and become corrupt. We do all various vices.
So the blame should be on those people holding offices?
No, not
Please,
granted.
Can you allow the honorable member to proceed with her point?
Yes.
Go ahead.
I entirely think that it's us, we as Ugandans, are the ones defeating service delivery. We are defeating it fully.
You have a point of order coming
Thank
for
you very much. She's misguiding the House. There is what we call collective responsibility. And government has the obligation to bring a mechanism of implementation. If you're given office, what's the mechanism to bring you to the task of fulfilling your obligation as a person who's holding power on behalf of the government? Thank you very much.
Okay.
Do you think he had good information for you?
He didn't.
Go ahead with your point, Honorable Member.
My point is governments and trusts. You don't expect government to see through your heart, to know whether you're corrupt or not. It notes on your personal integrity. And mechanism. I think the government has tried. There's no one who works at Ministry of Public Service. There's a forum that is followed. You put in your papers, you do everything, the requirements are set clear. And I think it's we individuals failing governments. Actually, don't think we are failing. We Ugandans are failing governments.
Yes, Haj.
The facilities we are talking about are not enough, actually. For example, in Chambogo University, we have our medical center there. But it is a problem. You can go and check, test, and do whatever. But you can't get any, like a Panadol, you can't get it from there.
So why do you go there for tests if there are no drugs?
You go for services because they are prepaid, but you can't get the services you are expecting to get from there.
Thank you, Honorable Member. Yes, make your point, please.
One thing is government should stop politicizing, should stop mixing politics with the health. There's a difference between the two. Because here,
how are they mixing politics and health?
The government just comes in during the time of votes. That's when they come in to show that they're helping the people. That's when you see, now that's when you see Mulago is being renovated just because they're targeting votes. But when they get the votes, you never see them again. So they should stop mixing politics with the help of the people. Those are two distinct things. And the government should punish the corrupt officials. We have corrupt officials in the Ministry of Health. People report them, but they're ever there. You report them, they tell you you are going to work on them, but you find them ever there. The government should punish them, should scrap them off even on the payrolls because they don't deserve payments. So I believe when the government does that, Uganda will be a better country. Thank you very much.
Thank you, Honorable Member, for keeping time. Please, can you keep time like he did?
Thank you, Madam Speaker. I'm Mwesige Joram. I represent Chenjojo District. I stand here to credit the government to the extent that people have come out to name Mulago Bona Mafe. Actually, for me, I try to...
I have been treated in Mulago, not once, not twice, but several times, freely. And the medicine was given. So I don't know where you get the allegations. I don't know where you get the allegations that there is no medicine. That there is no medicine in Mulago.
We need more money in the health sector, I think, is what everybody is giving us. What else do you think should improve this sector?
The second issue we should do is maybe to minimize on the brain drain, because many doctors are running out of the country. This was, for instance, Mr. Sebagala put it on board that he went to South Africa for an operation, but out of the 5 lists of the doctors was given, he found out that 3 of them were from Uganda. Why is it so? Because of the inadequate payments they are getting. What should the government do is to adequately finance the health sector so that their wages and their salaries should be at least high, so that they can keep from within the country and not go outside the country. That will help us to improve on the health sector.
Thank you. Thank you, Honorable Member. What are the solutions, Honorable Member?
First of all, what government should do is to restore confidence in its people that the health services provided by the health sectors are worthy for the citizens, by our leaders going for medical services to the very facilities where we, the normal citizens go. The second, I think that should be done is there should be incentives of work to the health workers. Let them improve on the accommodation of the midwives, of the nurses, and the doctors, so that a doctor should not stay outside a district where he's supposed to work.
What the government needs to do is to regulate whoever comes into the health sector business. But we should privatize, but it is to regulate. The point comes in where the government has to regulate. Not anyone can come in. But if we accept to share the cost of health by privatization, we shall... we shall be managing health, because the government as a single body can't like fully fund the health sector, because we are still in a developing country. We still have some other important aspects.
You have the floor, honorable member. Please come and make your point.
I think the government should not privatize the health sector, because we already see an example from Omeme, the former UEB, that was privatized, and now people cannot even afford to pay Yaka bills. They have now resorted to stealing power. They tap power, which was not even, that thing was not there those days. There was no power theft those days before this thing was privatized. So what I think, government should actually increase more budget to the health sector, so that all these necessary facilities can actually be bought and equipped, equipped in the hospital. Another thing, I advise government to also eat the food it serves to its people. Why do you serve food and fail to eat? Why do you, why do you construct a hospital and you want to go to another place to get treatment? I think that will motivate the citizens and even the health workers who are working in those hospitals.
Another thing what the government should do is close supervision and monitoring of the government hospitals or government health centers. That workers are there but are not monitored.
What I just want to stress that our government should do, first of all, you know that if a worker is discouraged, this issue that someone has completed a course, has done some course, has the papers, and someone has gone for a job, and you ask somebody, do you have a working experience, a job experience? No wonder a doctor, someone has been studying medicine for 5 years. Where is the school for experience? Give that person an opportunity, let him work or her, so that he gains that experience. So if you tell the person like that, a person will go for brain drain, looks for green pastures in other places. That's why our doctors are running to Rwanda, Southern Sudan, because of those questions. What our government should do, they should make sure that they train this village health team, these village health workers here, where the VHs in villages. At least they should give some qualification. You cannot put a VHG who has not even a paper, or a P7 paper, PL paper, or even a senior 4 to be a VHG. For what?
I am dreaming of a Uganda where we take individual responsibility, whereby we tackle things in a manner that is not driven by hatred, that is not driven by sector, by our own motives, but rather the issue. When you're talking about health services, recently, much as I'm a greater advocate of change, but recently Museveni was in Mulago launching its renovation. We should credit him for that. And the suggestions are, I think the suggestions are, we as individuals, I'll put it on individual responsibility. We as individuals, we as people who want better health services, like doctors, they should start by having the willingness and the love of the country to work at the available salary that is offered by the government, and then later advocate as they meet their personal responsibility. Thank you.
Thank you, honorable members. We have come to the end of this show because of time constraints. We cannot continue. But leaders, ministers, members of parliament, I hope you have heard people's voices who are crying out for better health services in this country. Let's hope you implement their voices. And please, those who are watching, NTV People's Parliament is seated at Royal Suits, Bugolobi, where you are free to come and have your say on the topics that are discussed in this parliament. Also, keep visiting our page on Facebook, NTV People's page. Like it, and please watch out for the next topics. I am still Agnes Nandutu, the Speaker of People's Parliament. I adjourn this house. Until next time.